Hi, friends. Welcome back to the Mama Doc Baby Doc podcast for another episode. If you're new here, I'm Rachel. I'm a pediatrician, and this is Renda. She is an OBGYN physician and my mother.
Hi, everyone. Welcome back. Welcome back for another episode.
Okay, Mom, so tell everyone why we should be jealous of you and where you just got back
Oh,
from. Why you look so
well,
tan.
I'm actually not even back yet. So I just got to spend 10 days in Greece, which was pretty fantastic. When you live in Alaska, it's important to get out and get unfrozen
Sunshine?
every once in a while. Sunshine. Yeah. So we went to Greece for 10 days, and I'm currently in Albuquerque, New Mexico, another sunny, warm place. And I'll be home on Sunday. So I will have been gone for, 2.5, almost 3 weeks, which is pretty
Wow,
fantastic.
that's very
Yeah,
nice. Soak up all the sun
yeah,
before the winter.
that's right.
I
So,
need a beach trip.
Rachel, well, you have a baby, so that's
I
another
know.
topic altogether. But our
Mhm,
topic for today is viral upper respiratory infections, also known as a cold, right? And since we're
mhm.
talking about it, how is JJ? Because the last thing I think he had a cold. I remember he wasn't feeling well right before I left for Greece. Is
Oh
he
my
all
gosh,
better?
this kid. No, I don't think he'll ever be better, and that's okay.
Oh,
He actually only
yeah.
had one little instance where he had fevers, but he has had a constant runny nose, green, nasty, goopy from his nose
Ew,
for the
poor
past few
baby.
months, and like a cough that sounds like he's coughing up a lung.
Oh, poor
Yeah, so
baby.
but he is super resilient and acts like nothing's wrong. He still plays, still's happy. The only time he wasn't feeling quite as well as he normally does is when he had the fevers. The fevers really took him
Mm,
down, unfortunately.
yeah, yeah. Yeah, well, I'm glad he doesn't have a fever. So today we're talking about viral upper respiratory infections. So,
Mhm.
so just that, a virus that has infected the upper part of your respiratory tract. So first of all, the respiratory tract includes parts of your body that you use to breathe. So your
Right.
nose, your pharynx, which is what connects the nose and mouth, your larynx, which is the area that connects the pharynx to the trachea and where your vocal cords are, and then of course your trachea, lungs, the bronchi, which are the tree-like branches or for the airways in your lungs, and then the lungs. So the virus can really attack all or any of those areas. Your upper respiratory tract, your nose, pharynx, larynx, your lower respiratory tract, which includes your trachea, your bronchi, and your lungs. So, for example, if you have a viral pneumonia, that's a viral infection that's attacking your lungs. A viral
Mhm.
bronchitis is a viral infection in your bronchi, and so on and so on. So, viral upper respiratory infection is a viral infection, usually of your nose, pharynx, and larynx. And we usually call it the cold, a cold, right?
Yeah,
Yeah,
exactly,
yeah,
yeah, and, there are so many types of different viruses that can cause
yeah.
colds. There's over 100. There's so many. You might have heard a few names of these viruses. Rhinovirus is one of them, enterovirus, adenovirus, influenza or the flu, parainfluenza, human metapneumovirus, coronavirus, and then COVID, which is a type of coronavirus, and RSV. These are all types of viruses that can give you upper respiratory infections. And, the classic
Right.
symptoms that we see with viral upper respiratory infections include fevers, runny nose, congestion, cough, sneezing, headaches, sore throat, mucus production, and body aches. Basically, just not a fun time for anyone
No, not
else.
fun. No. Yeah.
um, I know, there's also that old wives' tale out there that says that green mucus means you need antibiotics and clear mucus means you do not. So, like if you have a runny nose and it's green, you have to get antibiotics right away. But really, that's not true at all. Green mucus can be present with viral or bacterial upper respiratory infections. And you really cannot tell by the color of the mucus whether or not antibiotics are going to help you at all. So keep that in mind. um, if you have ever had these symptoms and you went to an ER, they will sometimes swab your nose. Um,
That's
I know
right.
we're all very familiar with the nose swabs from
From
COVID, but
COVID. Right.
most of the
Right.
time they're not as bad as that. They just go just directly in the nose, not like touching your brain. But if you go to the ER, they'll
Yeah.
sometimes swab your nose and tell you if you're positive for one or more of these common viruses. You might have heard, oh, you have rhinovirus, or oh, you have COVID. That just means that that is the specific virus that is attacking your upper respiratory tract and giving you those symptoms.
Yeah, the ER, I know that they sometimes do the nose swab for viruses, and a lot of times those swabs test for like 50 different viruses that are the most
Mm-hmm.
common viruses. But even that doesn't include all the viruses that are out there, right? So even
Mm-hmm.
if that swab is negative, that does not mean that you don't have a viral upper respiratory infection. You could possibly have a different virus that's just not included in the swab, and that could be giving you those symptoms.
Exactly. Yeah. Most people, I feel like, have had a cold before in their life,
Oh, yeah. Oh,
at
yeah.
least one. Usually, they say adults get about 2 to 4 colds per year. But really, kids can get 6 to 12 or even more colds per year, depending on how much they're exposed to. I actually
That's
worked
a
with
lot.
a yeah, I worked with an infectious disease doctor when I was in residency who said, kids get usually 2 colds a month about. So, they
Wow.
could be sick almost the whole month during cold and flu season.
Wow. And I'm sure that that depends a lot on if they go to school or daycare. And then if they're younger, it probably depends on if they have older siblings who bring those viruses home from
Yeah.
school.
Yeah, exactly. It does. I mean, even just a trip to the grocery store or parents who go to work, you can pick
Right.
a virus up from anywhere. Um, I have a lot of parents who come to me and say, "We don't take her anywhere." And I'm like, "Well, you guys go places and there's other ways to be exposed besides the baby going out." And I do hear a lot of kids actually they get viruses when they go see a doctor for something.
Right.
We unfortunately, we do our best to keep sick kids separate from well kids, and clean the rooms really well in between patients, but it's really inevitable that they're going to get sick from somewhere. You really have to remember in babies, especially, their immune systems are new, not just babies, but toddlers too. And
Right.
one of the ways that our immune systems work is by being exposed to something and forming a memory of that bacteria or virus. So then it's easier to fight off later. But babies and kids, their immune systems, they're so new that they don't have a memory of a lot of these things where they're really seeing things for the first time. So that's why
Right.
they are going to be sick a lot more often than
Right.
adults.
Right. Okay. So let's start by talking about prevention. The
Hmm.
best way to prevent the spread of viruses is to keep distance from people, right? Cover
Right.
your mouth when you sneeze and cough, and then wash your hands frequently. Colds are spread by droplets, meaning that when someone sneezes or coughs, the droplets are sprayed out into the air and they kind of hang there in the air. And then if you breathe them in, you could be infected. For kids in daycare, I mean, they're in each other's faces all day and they will easily spread viruses from one to the other, right?
Yep, and they wipe the snot on each other, and, if you have kids, they'll just waddle up to you and sneeze right in your face. It
Yep.
is so rude.
Yep.
Um, I usually catch a lot of things from work where kids will just sneeze and cough on me all day, but, since JJ has been in daycare, John, my husband, has
Yeah.
been exposed to more things than he ever has, and so a couple weeks ago, he had fevers for the first time in years. And oh my gosh, talk about a man cold for that guy. Okay.
Oh,
He was covered in
oh,
blankets from head to toe and like moaning on the couch. It was bad.
poor John. I bet it was worse than JJ being sick.
Yeah, definitely. Definitely. But,
Aw.
that's also true. Try and keep your distance from people who are sick and cover your mouth when you sneeze and cough. It'll help prevent spread.
Right. Now let's talk about treatment.
Mhm.
There are not a lot of things out there to treat the common for treatment if their kids get a cold.
Exactly. I always say if I could make a treatment for a cold virus, I would be a millionaire and could retire to Hawaii or something. But you're
Yeah.
so right. Antibiotics will not treat a common cold virus. If you were to be given antibiotics, you would start feeling better in 2 to 3 days after starting the antibiotics, but it would be because your immune system would be fighting
Yeah.
off the infection, not because you started taking the antibiotics. And you might think it's working, but in reality, you are just exposing your body to antibiotics for no reason.
Right.
And as doctors, we're really trained in antibiotic stewardship. And this really means that we try really hard to only give antibiotics when they're needed. Not only is it not good for you as an individual to be exposed to
Right.
antibiotics if you don't need them, but it's also not good for the whole population to have too much antibiotic exposure. It can make the antibiotics that we give regularly less effective against bacteria. So we really need to keep our antibiotics effective for a long period of time, so that future generations can use them too. So we really try to
Right.
not give them if they're not needed.
And that's so important because that's why your doctor might not recommend antibiotics. It is also
Mhm.
why we might recommend testing to confirm if there's a specific bacteria before treating for a bacterial infection. For
Yeah.
example, I see a lot of women with urinary tract infections, right? And I don't just give antibiotics if you're having symptoms consistent with a urinary tract infection. We
Mhm.
want to get you to pee in a cup, and that is so that we can confirm that you do have an infection, because I mean, it could be a yeast infection causing irritation when you pee, right? And that
Yeah.
certainly isn't going to get better with antibiotics. And sometimes we even want to culture your urine to tell us which bacteria is causing the infection so that we can give an antibiotic that is specific to treat the infection that you have. So it'll work, right?
Exactly. Yeah, exactly. So, if your child is having cold symptoms, which is fevers, runny nose, congestion, sore throat, and a decrease in appetite, you most likely will not need antibiotics. If you're worried, your pediatrician will be happy to see you in clinic, and look at your baby or look at your kid, but don't be surprised if we tell you that their symptoms are most likely due to a viral upper respiratory infection and they don't need antibiotics.
Right. And I know there are definitely times when your pediatrician will want to see your child too. Um, so, can you talk about when parents should reach out to their pediatrician or when they should even like take them to the ER if they can't get in with their pediatrician?
Right, right. So commonly I talk about three things: fevers, hydration, and breathing. Okay, so let's start with fevers. A lot of parents freak out over fevers and ask me, how
Mhm.
high is too high for a fever? So the first thing is fevers are our body's normal reaction to having an infection. Whether it's a viral infection or a bacterial infection, your body will usually mount a fever. All that to say, in adults, we usually don't have fevers unless it's a pretty bad illness, but kids, they're different. They're going to have fevers more frequently and will get a fever with most viral upper respiratory infections. A fever is not going to hurt your child. I'm going to say that again. A fever is not going to hurt your child. And honestly, you don't even have to treat a fever. However, usually kids feel pretty crummy when they have fevers. They have a hard time sleeping and don't
Yeah,
want to eat. So we
right,
usually treat fevers in kids so they aren't miserable. Because if
right.
you have kids, if they're miserable, everyone else in the house is also going to be miserable.
Exactly. And I know that you can treat kids' fevers with Tylenol. And in
Mhm.
kids that are a little older, you can use ibuprofen. I think it's
Yep.
if they're 6 months, and they don't
Right.
have any kidney issues, right? So
Right.
you can
Mhm.
ask your doctor for the recommended doses for your child because it is a weight based dosing for kids, right?
Yep. Yep. Exactly. And another tip. this is a side tip for both medications, Tylenol and ibuprofen or Motrin. There are infants and children's options at the store. So if you're buying Tylenol,
Right.
the infants and children's is the same concentration. It's the same medication. The only difference is that the
Hmm.
infants comes with a syringe and the children's comes with a medicine cup. But if you purchase the children's Tylenol, but no, actually, what I'm saying is you should purchase the children's Tylenol and you can give them the same dose in milliliters as you would for the infants. The children's is cheaper, so please buy the children's.
That's
But
crazy. Right.
I know. Marketing thing, but this isn't true for the Motrin or ibuprofen.
Yeah.
They're different concentrations in the infants and children's. So you'll have to calculate out the correct dose in milliliters based on the concentration of the one you have.
Okay, so that is way too complicated. That is one thing I never liked about pediatrics. You have to do math.
I know a lot of people say that. Even John says that to me. I have to use a calculator. But if you are at all confused, just ask your doctor. They can calculate out your child's dose for you.
Right. Okay, so we said that fevers are your body's normal reaction to an infection, and parents should not freak out over a fever in their
Right.
child. But if they are having trouble sleeping or eating or just really feel miserable, they can treat the fevers with Tylenol or Motrin.
Exactly. I also get the question a lot of how high is too high for a fever. And actually, there is not an exact number for that. A high fever will not cause brain damage in a healthy person, and it will not cause febrile seizures. I know a lot of people
Hmm.
are worried about that when they get very
Yeah.
high. Temperatures. I frequently see 104, 105 in kids with just a regular viral upper respiratory infection. Just because it's high doesn't mean
Hmm.
that it's not a virus. But if you're worried, just reach out to your pediatrician.
So, when would you want a parent to call you if their child had a fever?
Yeah, so we frequently say if your child has a fever consecutively for 5 days, you should let your doctor know. Reach out to your pediatrician or take them to the ER or an urgent care. This is because fevers from viral upper respiratory infections typically do not go over 5 days. I have seen it go over 5 days with adenovirus, which is a virus. It can give you a viral URI. Um, Adenovirus, yeah, will sometimes give you 5 to 6 days of fevers, just as a upper respiratory infection. But that's the only case, and usually that does not happen. So if your fevers are going longer than 5 days, we want you to see your doctor. And that way, your doctor can find any evidence of a possible bacterial infection that might need to be treated. So, like maybe your kid
Right.
has an ear infection on top of their
Right.
cold, or maybe they've got a pneumonia secondary to their upper respiratory infection or a sinus infection or other things. So if you've had a fever every day for 5 days and it's not going away, you need to reach out to your doctor. Um, so that was fevers, then hydration. We also want you to take your kid to the pediatrician if they're having trouble staying hydrated. If your kid will not drink liquids and has become so dehydrated that they're not making wet diapers, we want to see them.
Right.
Less than 3 wet diapers in 24 hours or no wet diapers in 12 hours would be concerning. So if your child is unable to tolerate liquids by mouth, and is dehydrated, they might need to go to the ER to get IV fluids. So
Yeah.
call your pediatrician if you're worried about them being dehydrated.
Yeah. And then the last thing you mentioned was breathing. I know that kids, especially babies under 2 years old or kids with asthma, they can have a lot of trouble breathing when they get a viral upper respiratory infection. So, what should parents look for if they're concerned about their child's breathing?
Yeah, that is so right. Kids under 2 years old are at the highest risk of getting bronchiolitis. This is an illness that can be life threatening to babies, and we'll talk about it a little bit more later. But bronchiolitis in kids under 2 years old, and then kids who have asthma are also at risk. Because viral URIs will trigger their
Right,
asthma symptoms. So if their asthma is triggered and then their airways tighten up, they can have issues breathing. And this can be life threatening also if not
right.
treated appropriately. I always tell my parents that it's so important to know your child's normal breathing. That way, you can tell when their breathing is harder than normal or if their breathing doesn't look quite right. I know some kids have different shaped chest walls, or they might be thinner. That can make it hard to know if they're having difficulty breathing.
Yeah, we have a family member who has a chest wall deformity called pectus excavatum. And that's
Hmm.
something that a lot of people have where their sternum or the breastbone is more
Hmm.
sunken in and makes it look like their chest is kind of caving in, like
Yeah.
an excavator dug a hole. And that's the name excavatum. It's funny how I learned to remember things. But anyway, this deformity can make it difficult to determine if a child is having difficulty breathing, right?
Yeah, exactly. Because one of the things we look for is called retractions. And this is where a child is working so hard to breathe that their chest muscles are working extra hard to help open up their lungs to pull air in. And you can see their chest is sucking in around their ribs, around their
Right.
diaphragm, around their sternum, and even up here by their throat. It like sucks in. If your child's
Mhm.
working so hard to breathe that you can see these retractions where it's sucking in here every time they breathe, or in between their ribs, you can see it sucking in, you should contact your doctor immediately, or take them to the ER if your doctor's not open. Other things you might notice if your child's working hard to breathe is head bobbing and nasal flaring. Um, Head bobbing is where the whole upper body moves up and down, which makes it look like their head's bobbing, but they're working so hard to breathe that their head is bobbing up and down. And same with nasal flaring. Um, their nostrils are flaring to pull air in harder because they're having so much trouble breathing. But these are all ways that their body is kind of overcompensating for not getting enough oxygen.
Right. So, I mean, that can be very scary to see your child in distress like that. But no
Yeah.
matter what, even if you aren't able to see these specific signs, if you just feel like your child is working hard to breathe, just call your doctor. Um,
Mhm.
you said definite reasons to reach out to your pediatrician are fevers every day for more than 5 days,
Mhm.
dehydration, which can be less than 3 wet diapers in 24 hours or no wet diapers in 12 hours, and
Right.
then increased work of breathing, which can look like retractions, nasal flaring, or head bobbing. But if you're worried at all, just reach out to your doctor because most doctors, especially pediatricians, they're all really nice. And most of them are more than happy to look at your child and let you know if you need to be worried, or they can give you tips on what you can do to help them feel better. So, like we discussed, there's really not any cure for a viral upper respiratory infection, but there are things parents can do to help treat their symptoms at home. So, Rachel, can you tell us some of the things that parents might be able to do to help their child to get through a cold easier?
Yeah. So, like I said earlier, if I could find a cure, for a cold, or even a cure for just the cough in kids, I would be rich.
Yeah.
But probably every parent, if I could find one, would love me. But really, there isn't a cure. And honestly, there isn't a lot to treat symptoms that work really well. It's really sad. The studies that have been done show one, that using saline and suction to help infants control mucus, the mucus that they produce when they have a cold, is the only treatment that is proven to actually help symptoms in kids and improve their symptoms. That's one.
Wow.
And two, the studies show that honey actually works better than any cough medicine on the market.
Wow, and honey is yummy too. But
Hmm.
now I know that you told me that you use the little suction thing to get JJ's boogies out, and he really hates that, right?
Yeah. Yeah. Kids usually hate things that are good for them, but he hates this. And it is one of the things that truly puts him into a full blown panic,
Oh,
like fight or flight. You can see it in his face as soon as the machine turns on, and it makes me so sad. Um, One
oh,
time before I had JJ too, I was also babysitting one of my friend's kids, and I suctioned out her nose when I was babysitting her, and she got so mad at me. She like didn't talk to me for 5 minutes, and she was
oh,
like 1 years old.
oh, that's so funny. That's so funny.
She was
So
giving me dirty
for
looks. Hmm.
I don't blame her. So for
Hmm.
people who don't have kids or people who have not had babies recently, tell us what is saline and suction. How do you do it and what do you use?
Right. So when babies get viral upper respiratory infections, they produce a lot of mucus. Um, if you have had a cold recently, you might have experienced something similar, a lot of mucus production in your nose. Um, this gives us and kids the symptoms of runny nose, congestion, and it can make your cough worse. That mucus, it runs down the back of your throat and causes you to cough. This is also when you can hear and cough really bad in kids. They'll get a productive
Mhm.
cough where it sounds like they're coughing up mucus from their lungs. And it always freaks parents out. And it really makes them think that the mucus is coming up from their lungs. But most likely the infection
Yeah,
is still in their upper airways and the mucus is running down the back of their throat and then they're coughing it up to keep it out of their
right,
lungs.
right,
Especially in smaller kids under 2 years old, they have a harder time controlling that mucus. And as you can expect, their airways are thinner. So even a
mhm,
small amount of mucus can plug up their airways very quickly and cause them to have trouble breathing. So that's why we use saline and suction to help them control all that mucus and breathe easier. When we say saline and suction, we're talking about taking a small amount of saline and spraying it up their nose on each side and then using a suction device to suck it out along with any mucus that you can get to come out of their nose and pharynx. Saline that you want to use is just salt water. We do prefer you to use pre-packaged saline and not make it at home yourself. You can buy it at the store. There are many different brands. Little Noses is one of the brands. Boogies is another brand. But, please just buy one with only saline and no other additives. If you do want to make it at home yourself, just chat with your pediatrician and get like an approved recipe with appropriate mixing instructions for salt to water and that kind of thing.
okay, that's good advice. So now for suction, I know there are many different devices that you can use. There is a bulb suction that we use in the hospital. Usually, the hospital will give that to you when you go home after birth,
Mhm.
you deliver your baby. And that blue plastic bulb that your pediatrician uses, they can probably give you another bulb if you lost yours, or you can even buy similar bulbs. That just
Mhm.
the little plastic bulb that you squeeze, and then when you open it, when you let go, it sucks stuff in.
Yep.
But there are other suction devices that you can purchase. There are lots of brands now. There are straw type ones where you can put one end in the baby's nose and the other end in your mouth and then suck on it. Um,
Mhm.
I think there's a filter in there so that you don't
Mhm.
actually suck the mucus into your
There
mouth.
is. There's a
Uh,
filter.
okay, good. Phew. Uh, you can also use the hook and straw type of suction device and hook it up to your breast pump and use the suction from your breast pump to suck out the mucus. Other
Mhm.
than the straw type, there's many types of electric ones too that use batteries, or sometimes it's a rechargeable battery that creates suction to suck out the mucus. I know that you had an electric one when I was there
Mhm.
visiting you, and you loved it, right?
Yeah, yes. I ended up purchasing the NoseBot electric nasal aspirator. I got mine on Amazon. It is pretty pricey. I think I paid $130 for mine, but it is well worth the money, in my opinion, if you can get it. Maybe put it on your registry and have someone buy it for you. But it has 3 suction strengths and it does a really great job at pulling mucus out. I also had other brands of electric nasal suction devices. I did have the nose Frida one, and I did not like it. It did not do a good job. I wouldn't spend my money on it. It's $50, but I didn't think it did as good a job as the nose bot. And I've heard the straw ones are even better than the nose Frida electric one. Um, to be honest, I've heard that straw one is the best one out of any of
Okay.
them, other than the
Okay.
nose bot, the $130 one. So if the $130 is out of your budget, the straw ones are like $15-$20 and they work great. But bottom line is you will need one, so get one of them.
Okay. So I know you said that saline and suction is the only proven treatment to help with baby symptoms. But what else can parents do to treat their child's symptoms? I know there were a lot of things we did for our kids when you were a baby.
Yeah, there's nothing else proven that their studies back up and show that it helps. But I've
Mhm.
heard from a lot of parents other things that have helped their kids. I have a lot of parents who use humidifiers in the room,
Right.
saline nebulizer treatments. Like you can buy just like a nebulizer that does saline, or even, just putting kids in the bathroom and turning on the hot shower water to create like steam effect. Um, they do similar things, especially similar to the saline, but it helps kind of break up congestion so the baby or child can breathe easier.
Right. So, there are a lot of over the counter treatments that you can find at like the pharmacy, Walmart, or on the internet that are
Hmm.
advertised to really help with cold symptoms in
Yeah.
kids. Do any of these work or do they help?
Yeah. I have some parents who will use the Zarbee's or the Highlands cough syrups, and they say they feel like they help their kids and improved their cough. If you don't want to know what these are, they're like all natural cough syrups. They have honey and grapefruit and other organic ingredients.
And you said honey
They're
was good.
yeah, yeah. They're overall safe to use as directed, but remember, no child under the age of 1 should have honey. So we don't recommend these things if your kid is under 1 years old because they can't have honey because they have honey in them. I also have a lot of parents who will use the Kids Vicks Vapor Rub or other brands of
Right. I
Vapor Rub.
remember that. Yeah.
Yeah. And these are safe to use if directed, and kids safe to use as directed if you're using them in kids older than 2 years old. The American Academy of Pediatrics doesn't recommend them to be used if your kid is younger than you. There really isn't a lot of over the counter or prescription medications for cough in young kids. And the real reason behind it stems back to what we were talking about earlier. Their cough is most likely from an overproduction of mucus that's running down the back of their throat, and they're coughing up the mucus to keep it out of their lungs. So, if we use a medication to suppress their cough, that mucus could potentially go down into their lungs, plug up their airways, and give them issues with breathing and oxygen exchange in their lungs. So, for that reason,
Mm.
we like it when little kids cough. It's
Okay.
protective. And we don't
Okay.
want to suppress. It's a protective reflex. I know it sucks for parents, and I get it now being one, but it really is
Right.
protecting them.
Okay, but if the child is older and their airways are larger, they're less
Mhm.
likely to have issues
Yeah,
breathing from mucus production and they can
exactly.
control their mucus a little better. So at that point, I think it's okay to offer cough medicine, right? I
Right.
mean, most of the
Mhm.
time, what is that, 6 years and older?
Yep,
Um,
exactly.
and, and even then, we recommend to use it sparingly. Now, I've
Yeah.
also heard that some pediatricians will recommend things like Zyrtec, an allergy medicine,
Mhm.
to help with cold symptoms. And Zyrtec is an antihistamine. There's some thought that this might help cold symptoms as well.
Yeah.
It's also a relatively safe medication. We give it to pregnant women during pregnancy all the time. As
Yeah.
long as you use it as directed by your pediatrician, it's safe in kids too. So just reach out to your pediatrician if you would like to start your child on something like Zyrtec for cold symptoms.
Exactly. Yep, exactly. There are times when your doctor might want to prescribe a prescription medicine to help treat their symptoms. For example, if your child is having symptoms of nausea and vomiting, so much so that they're
Mm,
having trouble staying hydrated, we might prescribe an anti-nausea medicine like Zofran to help keep fluids down so they
right.
can stay hydrated. Or if your child has asthma or underlying reactive airway disease, we'll give them albuterol and sometimes steroids if they're having trouble breathing or if they're wheezing. Sometimes a viral upper respiratory infection can cause croup too. This is when
Mm,
the larynx, like you said earlier, a part of the upper airway becomes swollen and it causes their upper airway to become very narrow. It can be very serious and life threatening. If your child has this, what you're going to notice is noisy breathing. It can sound very similar to a wheeze, but it's actually something different. It's called stridor. But if you're noticing noisy breathing in your infant, whether it's stridor or wheezing, you should be seen immediately. For croup, we will either give steroids or a breathing treatment of epinephrine, or sometimes both, depending on how severe their symptoms are.
exactly, yes. And all these treatments, over the counter and prescription, they're all really just treating the symptoms. Nothing is actually treating the virus. The
Mhm.
virus has to be fought off by your body's immune system, and that's just going to take time.
Yeah.
Now, the only exception to that is flu. We do have an antiviral medication for the flu, and there are a few options now, Tamiflu, and there's a new brand also.
Yeah, I don't know the
Studies have
name.
been done on, yeah, I don't either. Studies have been done that show that if the medication is started in the first 3 days of symptoms starting, it's going to shorten the course of the illness by about a day. So you can also take it as a prophylaxis to prevent you from getting the flu if you know that your child was exposed. And for prophylaxis, of course, there are also vaccines against many viruses, flu
Mhm.
included. So if you get a seasonal flu vaccine, you can still get the flu, but the symptoms are going to be so much less severe for those who are infected after being vaccinated. And on that note, in recent years, we have moved away from a live virus flu vaccine. And the injectable IM form of the vaccine is now an inactive vaccine. A lot
Mhm.
of people have memories of feeling sick or getting the flu after they got their flu vaccine. And that was most likely when we used the live vaccine. Now the vaccine is inactive, and it's really, you're not going to get the flu from the vaccine. Your
Right.
arm may be a little sore and irritated, but you're really not going to get the flu from the vaccine.
Yep.
We also have new vaccines for RSV, respiratory syncytial virus. And those vaccines are available for every baby. And in their first RSV season, it's recommended. And we also give it to pregnant women during the third trimester, which is really exciting um, because pregnant women get the vaccine. They make antibodies that cross the placenta and really protect the babies from getting RSV, gives the baby immunity. In a future podcast, we're going to talk a little bit more about vaccines in
Yeah.
pregnancy. But Rachel, why don't you tell us a little bit about RSV and why it can be so devastating for babies?
Yeah. Yeah, I have seen firsthand many, many babies have to be hospitalized for RSV bronchiolitis. And many even have to be in the pediatric intensive care unit needing support breathing. It can be life threatening and really devastating. Um, RSV is a cold virus, just like any other cold virus. In adults, if you get RSV, you may get symptoms of runny nose, congestion, cough, maybe a sore throat. Um, the cough for RSV is normally the worst symptom. It's normally pretty bad, even for adults. And adults and kids, it can linger for weeks after the initial symptoms. Um, so, we talked a little bit about bronchiolitis earlier, but let's talk about what it is. So, in babies under 2 years old, like how we talked about, they cannot control their mucus and it can fall down into the smaller airways in their lungs and plug them up, essentially blocking oxygen transfer and making them have to work harder to breathe. This is called bronchiolitis. The bronchioles are the smaller airways in the lungs. But with RSV, there is an added layer of intensity in that the virus actually attacks the lining of the smaller airways and makes it slough off into the airway, which also plugs up the airway, causing issue with oxygen transfer and ultimately breathing. So that makes RSV the virus with the highest risk of causing bronchiolitis. If your baby has bronchiolitis, you will see kind of what we talked about earlier, retractions, nasal flaring, head bobbing. You might even hear them wheezing. They will sound like and look like it's hard work for them to breathe. And then to treat it, we use high flow oxygen nasal cannulas and CPAP. Which essentially pushes air hard and fast into the airways so that even though they're clogged up from mucus and sloughed off cells from the lining, some air is still able to get through and you can get that oxygen exchange.
So that sounds really scary. I'm really glad that we have the new vaccine for pregnant
Yeah.
women, not as much for the women as for the babies, right? And in
Yeah.
the third trimester, when moms get that vaccine, antibodies are passed from mom to baby through the placenta. So you're really giving your baby immunity, which ultimately protects them from getting RSV.
Exactly. Yeah. When I was pregnant with JJ, I basically ran to my OB asking for this vaccine. Even the nurses were like, "Why does she want it so bad?" And my doctor was like, "She's a pediatrician," and they were like, "Oh, okay." um, but we also have an RSV vaccine for infants in their first RSV season, and it's called Beyfortus. Last year was the first year for it, and it was in such high demand last year, and it was really hard to get.
Yeah.
We're really hoping this year it's going to be more accessible. So talk to your pediatrician if you want to get this for your infant, and you want to, if you can get it. um, Now, the Beyfortus is different from Synagis. Synagis is a monoclonal antibody. We've had it for a long time. It's used as prophylaxis to RSV for babies at high risk. So, like babies who have heart disease or babies who are born very premature with very bad lung disease.
Right. Awesome. Okay. So, to wrap up this topic, we talked about viral upper respiratory infections, also known as colds. We talked about what they are, how to prevent the spread, and how they're treated. We talked about why antibiotics are not going to be effective against viruses, but other things that you can do to treat symptoms at home, like saline and suction. We discussed
Perfect.
when to
Yep.
take your child to the doctor and what signs and symptoms might be concerning. But no matter what, if you're worried, just reach out to your doctor. Now, lastly, I know you probably get this question a lot. Can you
Yes. So, most of the time, what we say is you can go back to school once your fevers are gone. We recommend waiting until they are fever free for 24 hours with no Tylenol and no Motrin because, Tylenol and Motrin could hide a fever if they're really having one. After they are fever
Right,
free for 24 hours, they're welcome to go back to school. And, these rules also apply to COVID now. I
right,
know we
right.
used to quarantine for days to weeks if we tested positive for COVID, but this is no longer the rule. You can go back after 24 hours with no fevers. Really, you are most contagious while you have fevers. And honestly, you're most contagious before you even start showing symptoms, unfortunately.
Oh, that's too
Um,
bad. Yeah.
yeah. You will probably have symptoms of runny nose, congestion, and even a cough for days to weeks after your fevers resolve from your viral URI. But you're still okay to go back to school or back to work despite having these symptoms.
All right. Well, that was fantastic information.
Yeah.
And I think that's all we have for today. So I want to say thanks to all our listeners for joining us for this for another episode. We are so happy that you're here.
Yeah, we appreciate all of you guys so much. Tell your friends and family members to listen. And if you like our podcast, please give us a review. That kind of helps other people find us.
Right. And don't forget, we have a new episode coming out every week with new information on a new topic. And if there's a topic that you would like to hear more about, reach out to us on Facebook, Instagram, or I don't know, message us. See you next time.
Bye.
Bye.